Hello, wonderful viewers. We are excited to be here once again because it's Pink October and it's Breast Cancer Awareness Month. In Breast Cancer Awareness Month, women normally become the focus of attention because it is a disease that is noted to affect most likely women. Though rare, it actually affects men as well. Today, we are going to be talking to a consultant gynecologist and obstetrician and the CEO of the International Health Expert Group, Dr. Gamali Kwaminogre. Hello, Dr. Nogbe.
Hello.
It's Breast Cancer Awareness Month, and I'm sure many people would want to have a specialist point of view on breast cancer. And so that is why I've come to your office. I see you have a wonderful place here. So tell me, what is breast cancer?
Well, breast cancer is one of the common gynecological diseases that afflict women. And most of the time, people are unaware that they have a condition until it comes to a terminal point. So the most important thing about this is to know why we need to do breast examination early enough to be able to detect symptoms and signs of this disease.
Okay, so just delving right into breast examination. Why do we need to do breast examination? And if you could elaborate on how and what we should expect to find during this breast examination.
Well, the important thing is that many women may start having pains in their breasts, but it's not every pain in the breast that will be associated with breast cancer. Pains could be in both breasts, and it could just be related to the menstrual cycle. Most of the time, these are in both breasts, and they could be due to the hormonal background of the woman. Now, the other thing that we will be looking for are breast lumps. When you do breast self-examination, you yourself, you do an examination of your breast. You are trying to find out whether there are lumps in the breast. There is something which is unusual that you find in the breast so that you could refer yourself to your specialist or to the medical officer. Important also is to look at the nipples. Most of the time, if you want to differentiate whether this is an innocuous or something which is not worrisome, not troublesome, that you need to worry about, what we call benign disease. We have other sicknesses that you could find in the breast. But for breast cancer, if you have lump in your armpit, that should ring an alarm bell. If you have thickening of any part of the skin of your breasts, there we need to draw the caution. We should also see whether there are any flaky signs on your skin or hardening of your skin. One other thing that you need to look at then is the nipple. Whether there is retraction of the nipple. Sometimes we refer this as orange peel. You see, you look at the nipples and you see that there is retraction and there are signs on it as if an orange which has been peeled off, and you see those other dotted points on your skin. That should alert you that something is happening. One last thing that I would like to say from a public health point is that if you have nipple discharges, most of the time bloody, you have nipple discharges that is not breast milk, then you need to go to the specialist to find out what is happening. When you go to the specialist, he's going to do a lot of examinations. He'll do clinical examination. He might send you to do an X-ray, what we call mammography. He might do an ultrasound or other imaging procedures to find out whether what you are noticing is really breast cancer or not.
Okay, that was a wonderful view from a specialist. Before we leave, I'd want to know from you, what is the prognosis of somebody who has been diagnosed of breast cancer? Or how likely is the person to survive? How likely is it for a person to survive when the person is told you have breast cancer?
It depends on the stage at which this is detected. You know, the fact that you have a diagnosis of breast cancer is not a death sentence. Now we have a lot of opportunities to deal with this condition. Say formally, when I've said once they say you have a breast cancer, oh, very soon you will die. That is not the situation now. There are a lot of things we employ. That is why early detection is important. That some of these lesions, some of these disease points can be removed. You undergo treatment as the doctors will prescribe, whether it's chemotherapy, whether it is nuclear, radiation therapy. You know, so there are, or sometimes you simply remove that breast, and once it has not spread, there are what we call metastasis. It has not spread. Prognosis is good. People have had breast cancer, breasts have been removed, and they have been alive for the past 20 years and more. So it's not a death sentence. The most important thing is that you should seek attention early enough so that you can live a full life.
Thank you so much for joining us, Dr. Kwame Nogbe. It is interesting to note that my guest today has been my dad. Thank you so much. It's been a pleasure having you here.
Thank you very much. I'm glad that I have somebody who can step in my role.
I'm glad as well.
Thank you.
Thank you so much, viewers, for joining me. It's Pink October and it's Breast Cancer Awareness Month, and I'm excited to join you every week. My name is Dr. Setor. Dr. Setor Nogbe. My name is Dr. Setor, and it's been interesting being here today. Until later, join me on my next session. Bye.